Okay, hello my people. Welcome to Office Hours. I'm Dr. Adam Tice and super busy today, guys. But we're gonna stay the course and we're gonna talk about office hours. So, clinical office hours, clinical pearls, stuff that actually works, stuff that you need to know about but nobody's telling you. These are things that I've figured out from being in the clinic for a long time. And my favorite topic is digestion, because digestion is the root of everything, and it is the primary contributor to essentially all chronic disease by way of being the fuel for the inflammatory fire that then fuels and sets up for chronic disease based upon susceptibility, genetics, karma, all these kinds of things, the totality of your life bundled up to this present moment in time, and then things happen and your system encounters a challenge and it deals with it. So the digestion is the root of everything, and I've said it before, I'm probably going to say it like 3,000 more times. But today I wanted to talk about the naturopathic food intolerance evaluation and just say a little bit more about that. Those of you guys who have had the naturopathic food intolerance done, you've heard this, you know what I'm talking about, but the repetition is what will drill it into our minds. So, it's good to hear this stuff. It's good to hear this stuff yourself a few times, and then if you can share that or talk about that or teach that to someone, it will stick it in your brain even better. So that's really what we want to do, and we want to try to be able to pitch it to a 5-year-old. So that's kind of what I'm going to try and do. So food intolerance evaluation, I just want to go over a few of these things. So I spoke about this several sessions ago. There are different types of food intolerance evaluation. I mean, there's at least 4 big kinds of food reactivity. There's food intolerance, there's true food allergies, lectin reactivities, and food sensitivity. So I'm talking, and I've done all these tests. We've done these tests over the years. And again, I talked a little bit about that, and if you want to hear a little bit more about those different tests, go back and listen. It was one of the second or third session we did. I don't remember, one of the first ones. But talk about the different ones. But the intolerance, this naturopathic food intolerance, is specifically what I'm talking about. And I use this, and I do hang my hat on this one because it works. I did the other food tests. I saw, I understand how they work. I understand all that. But I mean, again, guys, I'm a clinician, so I'm interested in what actually gives the results and what actually gives the long-lasting, long-game results. And so that's what I'm interested in. I did not see that with other methodologies. I do see that with this methodology, the naturopathic food intolerance evaluation. So that's what I do. And if you on board with me, we have to know this. If there's any pushback on this or somebody doesn't want to do this, it's like, okay, let's just wait, hold off, time's not right. When you get all the way ready, come back and let's work it up. So it's that important. I won't even onboard anybody without knowing this information. It's vital. And so the intolerance means that you're eating something that your body does not digest well, like a lactose intolerance. The allergy is the true immune reaction to a food element. The lectin reactivity is a genetically based immune reaction against the protein itself. And you can see stuff, there are other material, you can do a deeper dive in that. The sensitivity is a food reactivity that is something through an unidentified mechanism. And if you don't digest well, what happens is, this is what we're looking at with this food intolerance evaluation. The food does not digest. It tends to sit and ferment and putrefy, and basically it goes rancid and putrefies in the intestine, and then that process itself creates toxins that then get absorbed and go into the bloodstream, and this is what creates the irritation and the inflammation in the susceptible tissues. And the purpose of the evaluation that I like is to identify what foods are doing this in your system. And some people know that they're not able to digest foods well, and then other people don't know. They say, no, everything's fine, okay, everything's fine. I say, okay, let's see. And is there anybody that doesn't have any food intolerance? I thought I was that person, but turns out I'm not. And I've had other people say, no, everything's good, because I personally, I don't have digestive issues, and other people, they don't have digestive issues, and I think, no, digestion's good, digestive fire is good, agni is good, everything's good. And I say, okay, well, what's the rest of the story? What else is going on? And so when that process happens, when this fermentation, putrefaction, toxemia process happens, that will go and affect where the individual is susceptible. And what does that mean? That means, what's your thing? For some people, they get a stomach ache. That's real straightforward, okay? That's digestive related, stomach ache, the end, very clear, super easy, simple, done. That happens sometimes. Other people, it's different. The digestion might be fine, but person may have headaches. They may get migraines. They may have had these their whole entire life. I did a call today with a woman that's had migraines since she's 10 years old. And I've done these calls before and worked with these headaches, migraines since I was 10 years old, 12 years old, 15 years old, and I'm 35, 45, 55 years old right now. And we've cleared those headaches up by way of cleaning the digestion up. And she's like, what are you going to give me for my headaches? I said, your digestion is the root of the headache. Let me start there. And again, guys, where do we go? Foundations. And I'm working down here at the foundational level. And I'm not going to give anything for a headache. I'm going to go for the digestion at the foundational level, try to clear that up, and remove the digestive disturbance. And then what happens, the food, if there are any food symptoms, they will clear up. They will definitely improve the digestion and improve the overall quality of the blood over a little bit of time, by way of improving the digestion, absorption, assimilation, elimination process. And when you clear that up, that headache a lot of times just goes away. And I may not even need to prescribe homeopathically or naturopathically any supplements or anything. Like, there's no headache supplement. Like, that's functional medicine. That's superficial prescription, because you could give a headache supplement, Butterbur, or some kind of like internet over-the-counter prescription, and that's cool. It's better than pharma. It's still superficial, and it's not getting at the root. So what do? We go down to the root, and we fix it there. We clear up the digestive disturbance. Again, what does susceptibility mean? For some people, it means the headache. For some people, their knees start bothering them. I had a case just today. This was a kid, a pediatric, an adolescent, 15 years old, and he was having these really like strong knee pains. And he had this weird symptom where his elbow would like lock out. And we found out his food intolerance, took him off it. I had his 4-week follow-up. I think we had to bump back. It was a little longer. It might have been a 6-week. And that stuff was 90% better. It's essentially on the way out. And did I give him any anti-inflammatories? Did I give him any chondroitin sulfate or any of this kind of like GNC functional medicine type prescription? No. I gave him a homeopathic remedy, and I got him off his food intolerance. I prescribed a few supplements, organ complex and omegas and minerals, standard issue naturopathic stuff, and he was kind of hit or miss on that stuff. He's 15. I don't really, that's okay. But he took his remedy and he followed his food intolerance. And I'll be damned if his knees aren't better. And I think they're going to stay that way. So what's the susceptibility mean? For some people, it's their blood pressure. For some people, it's the headaches. For some people, it's joint pains. For some people, women, it's menstrual stuff. It's this stuff that masquerades as endometriosis, or these PCOS, and of course there's more that's going on there metabolically and stuff like that. But if you work at this root level and identify this food intolerance, that stuff, it will clear up along the way. It will improve along the way as we fix the foundational stuff. Now, are we going to get higher up that therapeutic order, and we might still need to support a weakened organ system, or we might need to eventually give some natural symptomatic relief or homeopathic? Maybe. We can do that then and work at that functional level at that point if needed, as needed. But guys, I'm telling you for real, if you work at this ground level and tidy up the digestion using this food intolerance, it works. And it's what, like I always say, it will get better, whatever the thing is. Now again, digestive, IBS, IBD, bloating, reflux, that stuff. If you have that, if you're having those symptoms and that's your chief concern, days to weeks you'll get better. Let me figure out what this is, do some basic naturopathic support. I usually do a few other things to kind of speed the process up and cleanse the digestive tract and things like that. But those kinds of things, those are my favorite cases, because they get better so fast. Literally days to weeks. People come to me. I have these cases like every week, every month. People come in and the chief concern is digestion, bloating, reflux, stuff. And some of this stuff, guys, I've had the reflux since I was 15, 20, 25 years old. They may be 35, 40, 45 years old. And we clean that stuff up. They clean it up based on some information that we gather together and get the food intolerance evaluation in days, literally days. Weeks is being a little conservative. It's usually days that the system clears up because the food intolerance is removed. And I love the food intolerance that we do. I did not make this test up. I learned this test from my mentors. And maybe I'll go in some detail and tell the story about it the other day, but basically it came from the naturopathic profession, the naturopathic mentors, and that's how I learned this. I actually did not learn this in naturopathic medical school. I did further postdoctoral training and working with some of the lead vitalist naturopathic doctors in the field, and they taught me this stuff. So I'm standing on the shoulders of giants, of the people, the docs, that have been doing this for like 30, 40 plus years. And then, so, there's hundreds of thousands of clinical cases like this. And again, the people that are doing this, we're not researchers. We're not necessarily compiling this and putting this data on PubMed. So those of you guys that need the evidence-based stuff, I don't know what to tell you. I myself and the people that I learned from are clinicians. And that's what we base our stuff on, is like, does it work or not? Yes or no. It's like real clear. It's like, does it really matter what the data says? Okay, data is important. Yes, I'm not like saying I don't like data, but I'm saying real life matters more than what a study says, because the books can be cooked and the numbers can be cooked and fried up all kinds of different ways and presented. And anybody that understands statistics and research and statistics and things like that, you can cook the books and make things present just about any way that you want to. That's essentially what pharma does. So we don't really want to play that game. I'm not really interested in that. I'm interested in the results and does it work or not. And when it works for people for 10, 20, 30, 40 years, okay, there's something there. And this comes from our profession, and it comes from the docs that have been doing it a long time. And this is a simple finger stick test that we do this, and then there's a special analysis that's done to identify what the food intolerance is. And this, again, what's happening here is the poorly digested food sits and ferments in the system, creates a toxemia in that. The toxemia is the byproduct of the poor digestion, the maldigestion, and then that's the equivalent of like not changing the oil in your car for like, I don't know, 100,000 miles or something crazy. I mean, some of these cars are designed to do that with synthetic oils or whatever, but you get the point. It's like not tending to the fluids, and you get gunky blood. That's a technical term. You get sticky blood. You get inferior quality of blood circulating through the system, and then this irritates and inflames tissues along the way. And again, what's that mean? Where's the susceptibility? That's where you will feel it. That's where it happens. Short-term inflammation is a normal part and process of healing. And that's the natural inflammatory process. If you cut yourself, there's an inflammatory process, recruits all the white blood cells to come in, heal the area, okay, short term. And that happens inside also, but what we're really talking about is the long-term, sustained inflammatory process. This is the primary contributor, the driving element in all chronic diseases: allergies, arthritis, blood pressure, fibromyalgia, skin diseases, arterial diseases, cardiovascular diseases, everything. There is this component. Is that the only component to a pathological condition? Probably not. Maybe. There's usually multifactorial. Means there's usually, a little bit of this, a little bit of that, a little bit of this, a little bit of that. You get 4, 5, 6 things contributing together. You get the perfect storm. Boom, that sets you up again based on susceptibility, genetics, thing like that for a pathology. We can offset that and diminish that, even if it is a genetic familial component to that. If there's a strong family history, okay, we take note of that. But remember, we know now the central dogma of genetics, that kind of ABC 1, 2, 3 genetics, where the grandfather gives it to it passes down genetically like that. It doesn't happen like that, guys. It's epigenetically determined, means you are in the steering wheel. You are the driver of how your genetics, how your genome is going to open up and express based on the epigenetic, the environment around, the environment that is bathing your cells. And that, my people, my friends, is where the digestive component comes in, because this is happening every single day. And this is what's fueling the toxemia. This is what's fueling the inflammatory fire. So what do we do naturopathically? How do we evaluate this? What are we thinking? Well, when we work a case up, we go in and we follow the principles. And number one principle, naturopathic medicine, identify and remove the obstacles to cure. Identify and remove the obstacles to cure means identify stop driving with the brakes on. And this, in every case, there is some kind of food component that is there, and we need to identify that and remove that and see what tidies up and resolves along the way, and then start to work up the hierarchy of the therapeutic order, from the simple to the complex, moving through our principles. Once we remove the obstacles to cure, identify this, we can clean up the digestion. Then we can move forward and start to cleanse the blood and the lymph, because again, the digestion is intimately related to the digestion, absorption, assimilation, elimination processes. And the elimination processes, making sure the emunctories, the routes of elimination, open, that is prerequisite to being able to push and cleanse the blood a little bit. We got to make sure the pipes are open. We have to make sure the pathways are open to push that. So that's kind of what's going on with this food intolerance evaluation. There's a lot of different approaches to how to get people better, and I'm not saying this is the only way, but this is how I do it. This is how I was trained and how I was taught and what I actually practice, and it actually really works. So that's what we do. I wanted to say, just to kind of give you a few examples, and then we can kind of tidy up today's session, because this is a good download on the food intolerance, and it's super important. So just some common culprits as far as like, I call them the usual suspects as far as like what to expect. What to expect with your results. Those of you guys that have results, you know your results. So this kind of context behind these is just a nice reminder, or a little bit of just kind of incentivizing yourself, reminding yourself why you're doing this thing, why we do this thing, why it's important. Well, it's all this. It's the primary driver between chronic disease, and we want to stay in the domain of prevention. So we tidy up this stuff. But if this is totally new to you, then you might need to watch this once or twice, because I know I'm talking kind of fast. It's been a long day, and I just want to get the information out, and I'm committed to the office hours, and I want to keep the consistency here. So I think it's a little bit of a dense download, but it's good. Some of the things, the usual suspects that I'm going to identify, and I mean, this is kind of saying the reason I love this test, and A, it works, but B, it's super simple. If you guys have done any of the other food intolerance evaluations, and you get these things back, and they got all these nice, pretty, like, color-coded, sheets and everything's a 1+, 2+, 3+, 4+, and there's like 72 things that you're supposed to be mindful of and avoid and all this. And it's like, that shit is crazy. Nobody can really do that, not for very long anyway. Very few personality types can do that. And again, I found, based on experience clinically, that it doesn't really work. And that's not a good motivation if somebody's following their what they think is their food allergy or whatever, and then they're not getting better. That's not very much incentive to continue following the thing that shows you're intolerant or allergic to like 72 different foods or whatever. So making a little bit of light of it, it's kind of funny to me, but it's not funny really. We want to find something that's simple and elegant and effective. And the usual suspects that turn up most commonly, when we're looking for basic anti-inflammatory recommendations, here it goes: wheat, dairy, potato, egg, sugar. Wheat, dairy, potato, egg, sugar. And some of the most common food intolerances, and when we find this out, we find a primary intolerance, number one, and then there's secondary, a combination. So there's two things that we got to watch out for. And I'll give you some examples of the most common ones, and just to kind of food for thought. And some of you guys have seen this because you got them. And if you've never seen this, this is new to you. I think probably the most unique one there is probably the potato. And that's the one, man, that I get, it's super common. There's a really common intolerance is a potato and a fruit and sugar intolerance. Fruit and sugar, so it's that combination of the fruit and the sugar, and then the primary being potato. Those are really good. There's a lot of musculoskeletal stuff, so joint pains and things like that respond really well. They turn out being potato folks. So that's one that, a lot of people don't go and, hey, you know what? I think I'm going to cut out potatoes. Nobody really does that. Everybody goes after dairy or wheat or gluten, maybe eggs. Sometimes people do. Most people will go after dairy or the wheat, the gluten. Sugar, some people go after, and I'm talking about refined sugar and cane sugar. I am not talking about maple syrup, honey, or coconut sugar. That's a different reactivity thing. And I'm not talking about glycemic load or glycemic index or how it affects the blood sugar or anything like that. I'm just talking about for this food intolerance. So some of the most common ones, I told you the usual suspects for me: wheat, dairy, potato, egg, sugar. Common intolerances are dairy, fruit, and sugar, potato, fruit, and sugar, egg, fruit, and sugar. Those are really common. Another common combination is potato and grain. So I see a dairy and potato and grain intolerance a lot. Those are probably the ones I've seen the most of. There are others. There are other possible presentations, combinations, and stuff like that. But that's the big stuff, guys. So think about this, what I'm saying, this naturopathic food intolerance evaluation. This is what I'm doing in the clinic. If you got it, if you know, you know. And if you don't know, you probably need to know, especially if you found your way to this video. You know, I do this as part of my office hours, and I release these videos first inside my private community, which is the Human Handbook community. And that's free to join. I can leave a link below there. And then usually a week or so later, I will make these public and the public can view them. But we give first access inside the community. So you guys always get the first glimpse and kind of hot off the press. And then we do want to get the message out, you know, to the greater world out there. So I do make these videos public usually after a week or two, you know, when we get a new session out. So we keep it fresh inside the community, and then of course we want to keep the knowledge and the information free and available out there, free flowing. So that is what I wanted to talk about today. Super helpful clinically, and I hope you guys found this of use, and I hope you can get some benefit out of this. Stay tuned, and we'll have another session next week. Adios, guys. Have a great day.